Hello, my name is Ann Louise Aguiar. I'm with the Alumni Association, and it's my pleasure to welcome you to this Faculty Fellow event, Caring for the Caregiver in Troublesome Times. It's my pleasure to introduce Dr. Christina Hendricks, who is an associate professor and the division chair of the Health Systems and Analytics for Duke University School of Nursing. Her program of research and scholarly activities focus on developing and implementing interventions to train and support family and friends, caregivers in other words, of older adults in home-based care. She leads the Duke Elder Family Caregiver Training Center that offers enhanced hospital discharge preparation for caregivers of older adults. Hendrix is also a nurse investigator and researcher at the Geriatric Research, Education, and Clinical Center at the Durham VA Health Center. She holds a Bachelor of Science in Nursing from the University of Santo Tomas in the Philippines, a Master of Science in Nursing as a family nurse practitioner from the University of Alabama at Birmingham, and a Doctorate of Nursing Science from Louisiana State University Health Sciences Center. She completed a postmaster gerontological nurse practitioner certificate at Duke University School of Nursing. In 2015, Hendrix was inducted as Fellow of the American Academy of Nursing, and in 2016, she received the Outstanding Tomasian Alumni Award, the highest award given by the University of Santo Tomas to its exceptional graduates. So now, as we are ready to start Dr. Hendricks' presentation, we ask you to first watch a short 2.5-minute video clip from AARP, after which Dr. Hendricks will immediately take over. So welcome.
Hello, rise and shine. Okay. Okay.
7, 8, and 9.
He said,
No, again.
she said,
Holy moly.
yeah, you can come back, put a little.
Okay. Better than mine.
Is that my turn? No,
Keep your hands up.
Yeah, okay, flip. There you go.
Good afternoon, everyone. This is Christina Hendricks, and if you are going to give me 1 minute so I could go ahead and share my screen. And as you know, this is a live virtual presentation, so pardon us if there's going to be some glitches happening here and there, but we're going to try our best to make this as seamless as possible. Again, as Anne-Louise said, I am a faculty at the School of Nursing, and I've been a faculty for almost 20 years. My program of research has been in informal caregiving. As you have heard, my alma mater in my bachelor's degree is from the Philippines, and in Asia, we care so much for our parents, older adults, and it is actually our obligation to be able to be there for them when they need help from us. So when I completed my doctoral degree here in the States, my program of research has always been in informal caregiving. And my intent is to develop interventions so that I can support the family and friends of older adults who are passionate to care for their loved ones so that their loved ones will be able to maintain their residence at home for as long as possible. So for today, what we are going to talk about is informal caregiving in the United States. And there's going to be polls here and there to ask for audience participation so that our discussion is going to be as relevant as possible. As Anne-Louise mentioned, also, there is going to be a chat room that is available for everyone so that if you have any questions as I move along in my presentation, please do utilize the chat box, and Anne-Louise will be asking me those questions twice during the presentation. We have placeholders for Q&A. I'd like to emphasize the importance of caregivers' self-care as well in this presentation. So there will be plenty of slides to talk about how we care for ourselves as caregivers. I'm going to use many personal situations as examples because I think it's more powerful if you hear from someone like me as a caregiver to highlight some of the important points that we are going to mention in this presentation. And last, but certainly not the least, I would like to describe the Duke Elder Family Caregiver Training Program, which is a program funded by the Duke Endowment to the School of Nursing where I lead. And this DEFT program illustrates how Duke, specifically Duke University School of Nursing, is helping family and friends of older adults in order to make them prepared and feel confident as they care for their loved ones at home. And specifically, we have a video recording of one of the caregivers whom we have assisted because I think her story is pretty powerful and I'd like to share it with you at the very end. And hopefully we're going to have plenty of time for questions and answers since in my experience, I've presented this quite a bit last year. There have been many questions coming from the audience about how to care for themselves as they care for their loved ones in home settings. So the next slide is going to ask for audience participation. And I have a couple of questions over here. And I'm going to ask Victoria to assist in doing this poll. So the first question is, I want you to answer if you are a caregiver. And the definition of a caregiver is someone who is assisting a loved one, maybe a friend, a family member, and you're not paid to be doing these activities, this assistance that you are providing to your loved ones. So I will give about 30 more seconds. And you can hear my mom actually on the background. So pardon, I think she just sneezed and I heard her, and I hope it's going to be fine because she's actually staying with me while we're dealing with the COVID crisis. So we have about 74% participation, and one more second, then let's stop now. So 40%, 47% of the audience are caregivers. The sample size is about 25, and 52% not caregivers. So we have half over here. That's good to know. The next question is for those caregivers only. So if you have responded that you are a caregiver, Victoria, can we go to the second question? I'd like for you to tell me if you are a child, a spouse, a sibling, a relative, or a friend for the person you are caring for? We have 35% who voted, so let's wait for some more. Okay, so for those who responded that they are caregivers, many of you are the children of the people you are caring for. And I share the same experience because I'm actually taking care of my mom, and she happens to be here living with me because I have to protect her from the COVID-19 crisis that we are experiencing right now. She used to live with my sister in Winston-Salem, but my sister is a provider and her husband is a provider as well. And we feel that the best house or the best location for her to stay is with me, since I'm a faculty and we've been working from home since March. So her exposure to the COVID-19 virus is minimal. So as you can see here on the screen, there are about 17% adults age 18 and above. That's roughly 40 million adults in the United States who are caregivers. Most of them are female, but there's an increasing number of male caregivers now based on the demographics of people here in the United States. And this is important for us because if you are a female caregiver, your needs are quite different from that of a male caregiver. In fact, when I have been doing my program of research in caregiving, I've actually conducted a couple of randomized controlled trials. The way we provide support and education to female caregivers are more of hands-on and more of psychosocial support, whereas for the male caregivers, they're more task-oriented. They want to know the technical aspects of caregiving. That's why it's important for us to know the demographics of the caregivers, because we have to adjust the support and training that we're providing to caregivers based on their demographic characteristics. Majority are working. And I think this is important for us to also know, because if you are working, then your flexibility is actually limited to face-to-face training. You would learn later on that in the DEFT program that I will describe to you, we offered face-to-face training. Almost all caregivers are wanting to have the training, but when they found out that it was face-to-face, many of them said, no, I can't make it because I can't take off from my work. That's why we're now looking into maybe the telehealth approach is going to be a good way to provide caregiver training as well. In fact, with this COVID-19 crisis, the telehealth approach to healthcare and caregiver training is probably the way to go. 6 out of 10 or 60% care for an adult with long-term physical conditions. Many caregivers, especially children, are caring now for their parents who have dementia, who have some cognitive impairment, and they're just not ready to let go of caring for their parent. And many of them have to deal with agitation, maybe combativeness of behavior. So we're dealing a lot with how to support family caregivers so that they don't get too much anxious and depressed and fearful if they're dealing with someone who has some cognitive decline at home. And the average here, it's actually in the 50s, 49 years old. It's actually my age, and I am working full time. It's typical me. If you look at the characteristics of a caregiver, it's a typical female, my age, working full time. So you can just imagine the burden and the stress being felt by caregivers because of all these things happening to them as they care for their loved ones, and at the same time they have to take care of themselves as well. The second audience participation that we're going to have is for those who are caregivers, or if you're not a caregiver yet, if you have seen someone who's caregiving, how would you describe, or what statement below best describes the caregiving experience? Is it mostly positive or is it mostly negative? Because it takes time away from the things that the caregiver would like to do. We will give about 3 more seconds. Okay, so majority feel that, oh, this is great. It's mostly positive as I have an opportunity to take care of someone who is close to me. Actually, this is a little bit unusual because many of the caregivers that we have encountered with here at the hospital or here at Duke, and many of the caregivers I have invited to participate in my research trials, majority of them will share that they feel depressed and they have this burden because it is one more thing that they have to do in their lives. So this is great that in the audience that we have at the moment, many of you have this positive way of viewing caregiving. The next slide, I'm going to talk about the different reasons why caregiving is being viewed positive by people, by the caregivers. There is an opportunity to grow as a person. You become more patient. You become more tolerant of differences. You have more space and time as you deal with frustrations and as you deal with things that sometimes you don't have any control of. As far as my mother is concerned, there's a sense of giving back to her because I know she's cared for me when I was little, and this is a time for me to provide her the care that she deserves and provide a way for me to say thank you for her. There's also satisfaction of knowing that their loved one is getting excellent care. For those of you who are providers, or for those of you who are really very meticulous in providing care to your loved one, you know that if it's you, it is the right care that your loved one is receiving. And that's how I feel about my mom, taking care of her. I know that I would not shortcut. I know that her condition situation is priority, that I don't mind doing an extra step because I know that that's the right care that she needs to get. Some people would say there's an increased meaning and purpose in one's life, especially if you are not raising your kids anymore and then you have your priority now is taking care of your mom. Then it increases meaning day to day. When you wake up in the morning, there is someone that you need to do. And hopefully for those who have children, you're passing on an example that should you need care in the future, that there is someone who has witnessed you take care of someone you loved, and this exemplar will place a lingering impact on the person, on your child, so that when you do need the help, that this person is going to be helping you as well. Now, we also know that there are many people who feel depressed, who feel that they do not have control of their lives anymore, that they have to be there for their loved ones every day. And we see this quite a bit again in the caregivers dealing with cognitive decline, because it is something that doesn't end shortly. Dementia, actually, the trajectory of dementia is about 10 years from diagnosis to end. So it is a long-term caregiving, and the burden only increases, especially if you have this negative mindset and you don't have social support. And this creates a high level of stress, feeling of frustration, being angry. There was a landmark study done a decade ago. It was a long time ago, and it shows that being a caregiver is actually a risk factor for morbidity. What that means is that if you are a caregiver, you're more likely than the average population to be sick or even to be dying early. And that's how stressful caregiving has been. And that is one of the reasons why there's so much attention, resources being devoted to caregivers right now. But the key is, are we giving the right resource to the person based on the caregiving needs? Because as you will see later on, it depends on where the chronic disease is, if it's early diagnosis, if it's after hospital discharge, if it's end of life care, caregiving needs differ. And you have to make sure that there's a good match between what the caregivers need and what you are giving as support or assistance, because if they're not important, then you're just creating overload information to the caregivers. About 1 in 10 caregivers, or 10%, reported that caregiving has created some challenges in their physical health, and it has gotten worse. And because of their caregiving, they're less likely to be involved in some self-care. So let's look at, let me just arrange my view so I can see the graph as well on the monitor. So as far as the impact on caregivers, these are actually data provided by AARP. You can see that it is the emotional stress. I want you to look at the emotional stress, which is at the middle of the two bars. The middle bar is what you look at. You could see that the highest impact is on the emotional stress. Physical, perhaps when your patient has, or your loved one has some physical limitations that you have to provide some physical care, then it creates physical strain and financial strain as well, because many of the caregivers are currently employed. But look at the emotional stress. If you look at the some impact, moderate impact, and high impact, you would see that an overwhelming majority of people are feeling emotional stress. They feel guilty, they feel frustrated. Caregiver burden is actually a concept that's always measured by researchers in trying to understand how to best support caregivers. And there are many tools that we can use to measure burden. It's also, a caregiver strain is also a concept that we're trying to measure in order to give us an idea of the emotional situation amongst caregivers, whether there's emotional stress or if the caregiver is still emotionally healthy. Now let's gear our discussion towards what's happening nowadays, which is the coronavirus pandemic. There are some characteristics of this pandemic that makes caregiving more stressful than it already is. One is the physical limitation to providing care. So my mom has severe problem with her breathing, and she needs assistance because she is also severely osteoarthritic. So what happens is that I have to be always conscious about being far away from her, or if I'm there to be close to her, that I'm wearing a mask so I can protect her from this potential coronavirus. And that to me, sometimes if I forget it, because she doesn't mind, but if I forget it, I feel so guilty about the possibility of transmitting that virus that I'm so much alert the following day to make sure that I stay up with the symptoms that she may be experiencing that will give me a clue if there is some problem going on. I don't worry about myself because I feel confident that if I do get the coronavirus, that hopefully I will be able to survive because I'm pretty healthy. But I protect myself in order to protect her. And I do a lot of things that I'm more careful because I worry about her. And I think that you probably can relate to that if you have a loved one living within the same household as you. There's also uncertainty about the disease. We really don't know what the signs and symptoms of this COVID-19 disease is. There are so many versions of what we need to be monitoring. Initially, they were saying that the older adults are at high risk for getting this, and for the children, probably not so much. But if you watched the news yesterday, this inflammatory, systemic inflammatory disease is being seen among children now, and they're worried that this is also being caused by the COVID-19 virus. There's also the economic impact we are all worrying about. Here at Duke, we're already beginning to talk about reentry, and reentry means that we need to set some guidelines on how we will go back to the building. And there's still no date on when the reentry is going to happen. But I think what is making this reentry discussion so urgent is that everybody's worried about the economic impact that this virus is going to cause, not only to my individual financial situation, but to the school's financial situation, or to the health system's financial situation as well. So how do we address some of the challenges that we are facing related to the COVID-19 pandemic, the coronavirus? I think that knowledge helps, but the challenge is, where do you get this information that are reliable and just not making you worry a lot more? And I actually have a couple of suggestions that I would like to share with you, and I hope this is going to work. But if it doesn't, I am going to show you the slides that will allow you to see the link. So give me a moment again, and I'll try to see how we can make this happen. So there you go. There are two slides. The first is, there are two sites. The first site is one that gives you facts about the coronavirus. It gives you statistics. And if you're like me, wanting to stay on top of the incidence of coronavirus, how the different states are doing, then this is the site for you. And I actually can pull this site up if we have time later on, because it will take several clicks before I can pull this site for you to see. If we have time, I'll do that at the end of the presentation. The second site is about issues that one can do to be able to maintain one's well-being. So this is a site, this is actually maintained by Duke, and it gives you several strategies on how to enhance your physical well-being, your mental well-being. And I like this because these are practical strategies. Of course, the strategies have already been vetted. It's been published here at our Duke site. So if there are two sites that I highly recommend for you to go to in order to stay on top of the COVID-19 crisis, and these are reliable information. So for objective information, it is the site maintained by Johns Hopkins. And for some information on strategies to help you cope, not only emotionally, psychologically, but also physically, go to this today.duke.edu site, because it contains a lot of fabulous information, and they also update it on a daily basis. So those are the two sites, and let's go back to our PowerPoint presentation. So for the overall caregiver self-care, let's talk about you, those who are caregivers, and those of you who are not caregivers. Said that everyone is going to be a caregiver, it's just a matter of time. So there are three guiding principles in caregiver self-care that I want to share with you. And hopefully these three things are something that you will remember. These are the three take-home points for this presentation. One is that you can only care for someone when you care for yourself. I know it is so self-explanatory, but sometimes when you feel that you are so stressed and you're just trying to do one more thing before you go to bed, you have to remind yourself of this guiding principle that without you, without a healthy you, there's not going to be care that will be given to your loved one. The second guiding principle is that you cannot do it all. You can only respond to some of the needs of your loved one. And it is going to be very helpful if you set the boundary in the beginning. I used to, when I say I used to be a nurse practitioner, it means that I run a primary care clinic before for older adults. So I am also a nurse practitioner. I was taking care of many older adults about 5 years ago. And the older adults will visit the clinic and they would have their caregiver with them. And some of the older adults were suffering from cognitive decline. I firsthand witnessed the guilt and the sincerity of mainly spouses taking care of the older adults, and that they didn't want to let go of their spouse at home for as long as possible. And I could see that they were already beginning to be burdened. So one technique that I found really helpful is I engage with the caregivers, discussion about care. And very early in our patient interaction, I would ask the caregiver, if you are to tell me a situation that will happen to your loved one that you would not be able to care for him anymore, or you may be able to tell yourself that I can't do this, what would that be? And probably after asking that question, no response. But later on, I would follow that same question when I see the caregiver again. What that makes the caregiver do is to reflect what really is the tipping point, a turning point that I can tell myself that I cannot do this anymore. And once they have identified that, I actually write it on the chart, or I tell the caregiver, write it down, because I monitor that condition and situation. And if I know that the patient has started to manifest that condition and situation, it is easier than, well, it's never easy. The caregiver is open to discussion about potential placement to a facility. But if that has not been discussed, and if you just suggest placement to a facility without previous discussion, it becomes very frustrating for the caregivers, because they feel that you are giving up on them already, giving up on their loved one. So for you, if you're taking care of someone who's caring for a loved one, and you see that this caregiver is a bit worn down and having a hard time letting go, maybe it's worthwhile engaging in that discussion with this caregiver. Or if you are the caregiver yourself, then maybe it's time to reflect the answer to that question and try to see what really is a tipping point. When would you know that it's time to seek for formal assistance? And last but not the least, and it's related to the guiding principle number 1, is that you cannot provide care 24/7, 365 days a year. I know sometimes you say, well, if I don't do it, who else is going to do it? You will be surprised that there are people around you just waiting for you to ask for help, ask for assistance. And once you try it and you hear a yes, then you probably would know that indeed this it is the truth. I always deal with caregivers who say that my sisters and brothers would not help me care for my parents. And when we say, well, have you asked? And the caregiver would say, well, they never call me. So the answer to that is, why don't you call them and just admit, or just say honestly that you need some help to be able to move on and care for your parent. And most of the times that would work, because they would know that you cannot do it all. The more that you do it all, the more that your other siblings would realize that maybe you can do it all, then they would not extend help to you. So it is a demonstration of strength to admit that you cannot do it all. And I highly encourage those caregivers in the audience to also think about who amongst your social network will be the person that you would approach first if you need help. Have a plan in place so that when you do need help, you know who to go for. And maybe right now, talk to the person and say, I can still handle my situation, but if I can't, I hope that I can call on you and ask for your help, so that you're also giving this person a hint, or a warning or pre-warning that you are the person I'm going to ask for help if I need it. With regard to self-care, there is physical health. We talk about that, and psychological health. And I don't have to really describe physical health as nutrition, sleep, activity. We all know those are important. Those are the key areas to be able to maintain physical health. For the psychological health, these are the areas that are applicable for caregivers. There is acceptance of the situation. There is acceptance of things that you can control. There are boundaries, set limit to what you can do, and reducing guilt. To me, I am a Catholic, I'm always guilty, but I have to tell myself that I'm doing the best that I can for that particular moment. That's what I remind myself all the time. Even later on, I find out that, it was not the best decision. I tell myself at that particular moment, based on the information that I have, that was the best thing that I can do. And that helps reduce the guilt, not necessarily eradicate or completely remove the guilt, but it does help me reduce the amount or intensity of guilt that I feel. Social network is also very important. In fact, when we did what is the most important support or resource to be able to maintain your quality of life, it is actually the maintenance of social support. It's having friends, social network. So friends are important. If you have a small network of friends, that's okay. You still have friends. Sometimes it is the quality that's most important rather than the quantity. Call on your social network. Don't think about, oh, I'm just bothering them. There's so many people who are just waiting for someone to ask help, and they're there to assist you. I do have a neighbor here where I live, and I keep on telling her, just let us know, because she's so fiercely independent, and we don't want to be seen as patronizing her too much, because it's not going to do her some good as well if we make her feel that she's not competent anymore. So reminding your friends that I will call on you if I need help, or even offering to your friends who are caregivers that I'm here on standby waiting for you to tell me how I could help, is going to be beneficial as well. I am going to stop here, Anne-Louise, and see if we have any questions that I can answer.
Great. So one thing, this is several people wrote in about not being physically having someone in their home, so caregiving in that direct sense. But I'm one of these people who also know from experience how difficult it can be when you're a caregiver from afar, an emotional toll, or you're coordinating all the aspects of the care that's not in your home, the financial aspects, and then there's still that emotional toll. You're constantly planning the visits, et cetera. I wondered if you could speak to that, the time and the energy drain, and also now in COVID-19, how there's that added stress of maybe not being able to have access to the person that you're caring for, but they're in a facility.
Yes, that's a great question. So let me answer first the first part of the question. We found out that many caregivers are not knowledgeable about the resources available for them. Not only for them, but for older adults as well. Let me speak about older adults in particular. We have area agencies of aging almost in every state in the country. And the area agency for aging has so many resources. Some probably you need to pay, but there are plenty of volunteer activities happening there as well. I think many of the what we call the long distance caregivers, their limitation is, of course, not being there physically. Therefore, they have to rely on resources or someone to help them do surveillance on their parents. And hopefully, the parent is still safe living in the house, and all the parent needs is surveillance to make sure that someone checks on the parent to make sure that nothing has happened. When we decide as a provider, one of the questions we ask ourselves in deciding whether this patient can still live at home is safety first. It's safety. What if the person lives by himself? What is the way to communicate? So we set up for Meals on Wheels, because we know that there's going to be someone who's going to be checking this person as this person delivers the meal. If that's not possible, then we can be friendly, or we can ask information about the neighbors. It is important for this person to be checked to make sure that the patient's still functioning well, is not lying on the floor waiting for someone to get in for help. There's also what we call the Life Alert. Life Alert, it is a subscription method, but it is something that a patient can easily use if a patient is in a situation that the person needs assistance. But the key answer to that question is know the resources that are available for you as caregivers, and resources that are available for the patients as well. Maybe the guilt is brought about by not being there, not being able to assure that your loved one is receiving all the services that this person needs. So knowing the resources probably is going to help you with your caregiving. The second thing is, with the COVID-19, because we are so far apart from each other and we cannot be liberal with our traveling, using technology. There is this thinking that older adults are not going to be very friendly towards technology. I wish I can show you my mom sitting on her love seat over there. She has her iPad in front of her, and she has a headphone so she can listen to the radio or watch movies. And my mom didn't finish high school at all, but we were able to teach her how to use the iPad. Of course, we had to make some adjustments on the iPad to make sure the fonts are big, that and we also made some labels. This is the volume, this is where you put the headset. But it is very possible, because all the technology right now would require only for a person to touch. It's a touch screen, it's not typing. So we found that to be easily navigated and used by older adults as well. And there's so many software that you can download on the iPad that are free that would allow you to have a video conference. It's the next best thing close to face-to-face discussion is at the video conference, just like what we're doing right now. Of course, there are many things to take care of, but if you are aware of the available resources, I think that's the first step that you need to do. Sorry for the long-winded response.
No,
and Louise.
there's another follow-up question. What are some signs that stress is affecting your physical health, your emotional health? Spare time, I know there are a lot of resources, but spare time can be a rare commodity for caregivers. So how can we find this time for self-care?
So what are the signs that you are experiencing stress? The stress can be manifested as anxiety or depression or feeling overwhelmed. And the specific symptom would vary from person to person. So what I would suggest is, I want you to, if you're not sure if you're feeling stressed, I want you to reflect on a certain incident, not caregiving, that you were stressed and what was your manifestation. In my case, I know I'm stressed when I'm getting short, when my patience is getting very short, that I easily get irritated by simple things because I know that I'm reaching my limit. And you should know that, because that would tell you to decompress when you are feeling that particular symptom or that particular sign. Like I've said, it varies from person to person. I don't overeat. People would say, well, if you're stressed, you eat a lot, but it doesn't apply to me because I'm just not that person. So each one should imagine a typical symptom that you experience when you feel anxious. And that's going to be the same feeling that you're going to feel when you're stressed. Self-care. If you're thinking of self-care as some going out of town for 2 weeks, you need to be realistic. That's not going to happen, especially if you're dealing with someone who has an acute problem. Before, I didn't believe in this guided meditation, the relaxation strategy, but I tried it. And to me, it works on me because it allows my mind not to focus on the stressful situation for 5 to 10 minutes. And that's all it takes. Just imagine, I'm sure you guys have taken a nap and it was just 15 minutes or 30 minutes. And when you wake up, you feel so refreshed. That is the same analogy, or that's the analogy that I can give for guided relaxation. So what you do is you think of happy thoughts. You force yourself to think of happy thoughts so that you force yourself not to think of the stressful situation. It frees up your mind. There are some applications on the phone that have some sounds that would actually help you decompress, and they're free as well. So if you go to your iPhone or Android, go to the app and just play and just type guided or relaxation music, it might help you. The key is take your mind off from the stressful situation so that it has time not to think of stress, but time to decompress and time to relax.
Right.
You will feel surprised that just doing it for 5 to 10 minutes will make a difference. And I'm looking at the clock, and Louise, may I proceed very quickly?
Yes. Why don't we let you get back to the presentation? And what I want to make sure everybody understands is that we can send out links to those resources you mentioned for COVID-19 updates, and also we can send that out to everybody who's registered, as well as a link to the video that we were going to play at the end, so that you might get back to your presentation. One last question that you might be bringing up anyway is there any national, state, or professional protocol for paid home health caregivers regarding PPE? It seems like some paid in-home caregivers are not wearing masks or otherwise and not required to do so, even when working with high-risk patients. So with that last question, I'll turn it back to you, and maybe you have a quick answer for that or want to get back to your presentation for our last 10 minutes.
Well, I can only speak for Duke University Health System because we have a protocol in place, and Duke University Health System has Duke Home Care Hospice. Duke Home Care is similar to home health, and there are protocols in place that every personnel needs to observe. I think if you are unsure or if you are concerned because you are not seeing a home health aide or a home health nurse come to the house with this PPE, what I suggest is to go to the facility or where this person is affiliated and ask for the protocol, and that's how you would know if there's a protocol in place or not, because merely observing the person come to your house, maybe this person is deviating from the protocol. And if there's no such protocol in place, then you can voice your opinion about what you expect as the standard of care should be. If they tell you, again, this goes back to who knows really what needs to be in place to address the COVID-19, because as of now, there are so many demonstrations happening because people are not believing the wearing masks when you're outside. So this confusion on what to do is a representative of the larger picture happening in our country. But it is your house. You can also have some wipes or some masks by the door, and you could request that this person observe these precautions, because quite frankly, I'd rather be very cautious and be over the top with this transmission rather than being lax and just hoping for the best that nothing's going to happen. So very quickly, because we have about 5 minutes left, and this always happens when I talk about caregiving that I go over time, I want to highlight what we're doing here at Duke University School of Nursing, because there's an opportunity for us to collaborate. We're always open to collaborations with our Duke alumni. And in fact, we are in the process now of putting our program into telehealth. We have been offering this face-to-face, but because of the COVID-19, we are limited to the amount of training we can offer, so that we are now looking into this telehealth caregiver training. And at the same time, we're always looking for sustainability options. And I know when I presented in San Diego last year, we talked about the business model of this caregiver training program. And I was so surprised about the magnitude and expertise of Duke alumni, and if there's something that you can provide us as, you know, suggestions on how to make this as a business model, we are going to be very happy to hear your thoughts. So very quickly, audience participation. I know, Victoria, we're running a bit out of time, but I'd like to see how many of you have assisted a loved one who has recently been discharged from the hospital. So about, let's see. Okay, so I would say about majority, 2/3 of people have had experience in assisting loved one, in the care of a loved one being discharged from the hospital. And for those who said yes, and we have about 22, can you tell me your experience, whether it's very easy, which is 1, that's letter A, or quite very difficult, which is letter E, number 5. All right, so we have between 3, 4, 5, nobody said it was very easy. All right, that's very good, because it reinforces that indeed this is hospital to home discharge is one of the teachable moments for caregivers. And for DEFT, we're actually trying to come up with training that's going to provide the education during the time of diagnosis, which is quite different if you look at their needs, or after hospital discharge, we're also going to have a training that's going to target caregivers who are experiencing decline in the function of their loved ones. So in other words, at the end of life care. So right now, what we are focusing on is the training and support that we offer to caregivers during the hospital to home transmission. I will focus on the bottom part of this slide. As you know, those people who have provided care to their loved ones at home after hospital discharge, that the first few days are very challenging. The first few days are the time that your loved one is still recovering from the symptoms of their diagnosis of their illness. And many times your loved one may come home with a medical device such as dressing that the caregiver needs to be changing, or an injection that the patient needs to be having. So we understand that the training and support is not enough. The training and support that is being given by the hospitals is not enough. So at the School of Nursing, we said we have the capacity because we have students, and we were funded by the Duke Endowment for about $1.5 million for 3 years to develop a program that will provide enhanced teaching to the family caregivers before they go home. And when they are at home, we're going to give them a call to follow up with the training that they have received from us and be there as well if they have questions or need support in the home caregiving of their loved ones. Before we discharge our caregivers from DEFT, we connect them with community-based resources. I think that was one of the answers that I gave to a question a while ago, is that once the caregivers are by themselves, what are they going to do? Who are they going to ask for help? They need to know about the resources that are available in the community so that they are just not left alone after we discharge them from DEFT. I know this is very quick, but that's the overall gist of what we do. We published, so maybe Anne-Louise, we can also give them a link to our publication because it describes in detail what we have done and the results so far. But here are snapshots of our results. We found that majority of the caregivers strongly agree that training is very much needed. They also wanted to know how to handle medical emergencies, also want to know new medications if there are some added or some deleted, and they would like to know more about chronic care management. Most of older adults, even if they are discharged from the hospital because of one condition, there are other conditions that the older adult is experiencing. Many older adults have 3 or 4 illnesses, and caregivers want to know how to support their loved ones with more than, with all these illnesses happening. What makes us excited is that when we trained, or after we have trained the family caregivers, it has also impact on the patients. Not only are they satisfied, but look at the readmission rate. The readmission rate of patients whose caregivers were trained was much lower compared to caregivers who were not trained. And we're putting this difference in readmission rate into dollar amount, because this is one way for us to convince hospital leaders and administrators about the cost effectiveness of having a caregiver training program. We are excited about DEFT because it is, in our opinion and to our knowledge, it's an academic and practice partnership. I'm not a nurse at Duke University Health System. I am from the academic side, but what I'm doing at the academic side is benefiting our practice partners. So that's very exciting for us. We are also a caregiver training program that teaches caregivers about skills. If you look at the many caregiver training or caregiver programs in the country, they're mostly support psychological well-being, some group support, but in our case, because we are nurses, we are from the academic side, we know how to teach the caregivers on the different skills needed for home care. And I don't know what to do, Anne-Louise, as far as the
Okay.
last slide is concerned.
No, I tell you, I think since we're at time, and I know you have another 1 o'clock that you have to dash to as well, we want to let everybody on the call know that we're going to send this video link, as well as we've got questions that weren't answered. We're going to print out, Christina, and see if we can respond to everyone who registered with some answers and some, definitely the links to some of the things that you've mentioned for follow-up. Because I hate to say that we're at time, but I do want to thank you so much for your talk today. This has been a wealth of wonderful information. And for everyone who joined, thank you, thank you. And we will be following up with additional information because this is obviously an important topic and we have a lot of questions still. So thank you so much, Dr. Hendricks.
Thank you. And I promise I would take time to answer those questions that have been raised. And if the email is provided as well, I'm happy to directly respond via email. Thank you so much. Take care,
Thank
everyone.
you. Have a good day, everybody.